This is another patient, patient 4, and his history was 15 years ago. We took out these upper teeth. They took out his teeth. He had advanced periodontal disease, and this is long before we had any idea of spirochetes or microscopic on these. We placed a maxillary subperiosteal and 5 immediate loading lower implants, and through the years, this patient was a heart disease patient with high blood pressure, and he had periodic infections. Every 2 or 3 years he'd come in with infection, which we'd do a revision surgery on, treat him with antibiotics, and only maybe 2 or 3 years later he'd come back and then he'd have another infection. So we finally decided to take the implant out. So we did a microscopic on this patient, and he had a very interesting pattern of spirochetes that were associated with a granule, and with 5 or 6 of these heavy twisted spirochetes, and of course spirochetes in other locations, but many of these morphologic structures that had a dark center but spirochetes radiating around. Whether this has to do with their reproduction, we have no idea. These little balls are thought to be red blood cells that are getting ready to die. We treated him with antibiotics for 2 weeks, and we found during the 2nd week that this patient still had viable spirochetes, and also these granular bodies here. Here's a viable spirochete here, and these dark bodies that are floating around. And somehow these spirochetes made it through the treatment we did with the flagyl and amoxicillin, and they were resistant to this antibiotic regimen. The patient actually wanted to try to save the implant at this point, but when we did the microscopic and found that he had resistant spirochetes, we decided to go ahead and take the implant out. And when we did the stop action, this patient also had these spore appearing bodies with the light refractive material in the middle with a dark center, and of course you can see the viable spirochetes still in this situation. So we feel that once we treat patients with an antibiotic, it forces that spirochete to revert back or become a more protected spore form. And when we went back and analyzed, let's look at patient 1. Okay, this is patient 1. At the time, we didn't know what these bodies were, but they fit the morphology of what we found in patient 2 and 3. So we went back and reevaluated this slide, and we found this same morphologic structure in this patient, and went back and reviewed many other patients that we didn't have any idea what these structures were. And all the patients with periodontal disease that had spirochetes, once treated with antibiotics,